including one person still being assessed. 7 of these patients are in ICU or high dependency units. 75 are in Metro Auckland hospitals and 3 are in Waikato Hospital. Just looking at the international situation, there's been a lot of coverage about what's happening elsewhere in the world, and we have clear evidence that COVID-19 vaccination both keeps people out of hospital and keeps them from dying. A British Medical Journal study reported last month, based on research carried out in Scotland, shows that the Pfizer vaccine was 90% effective in preventing death from COVID-19, where most infections were caused by the Delta variant. Internationally, we're seeing COVID-19 cases in Europe continuing to surge, with reports of more than 2.2 million cases and 27,000 deaths in the last week. That's more than half of the weekly global cases and deaths. And as we've seen, many European countries are now reintroducing restrictions to curb transmission and take the pressure off their health systems. And those countries include Germany, Belgium, the Netherlands, and Austria. That reinforces the importance of vaccination. And if you are eligible for vaccination, my message is do it now. On My Vaccine Pass, you will have seen the Ministry has now issued more than 2 million My Vaccine Passes. That means more than half of all vaccinated New Zealanders now have their pass. That's an incredible effort in just over a week, and thanks to everyone who's already done that and got their pass. My Vaccine Pass is an official record of a person's COVID-19 vaccination status, and that will help you access places requiring proof under the new COVID protection framework. And of course, that comes into effect from next Friday. We expect the demand for My Vaccine Passes to keep increasing, so we've today introduced other ways that people can get their pass. There is now the option to receive your pass through the post, and over the next couple of days, people will also be able to go to 400 pharmacies across the country to request their pass. Those pharmacies can be found on the HealthPoint website. There has also been an unprecedented number of people calling the 0800 number. To help meet this demand, we have also increased our call centre capacity, and there are now 3 call centres all operating extended hours. And finally, today, I'd like to acknowledge our frontline healthcare workers who are continue to play a crucial role in keeping us all safe and well. These workers, especially in Tamaki Makaurau, are working under significant pressure, and this has had a big impact on them, their whānau, and the way they live their lives. I know this is a tough situation for everyone, but I want to say that your mahi has not been unnoticed, and we really thank you for what you're doing. Please, everyone else, acknowledge the work that health workers are doing at this time and going forward, and remember to treat our health professionals with courtesy and respect. Back to you, Deputy Prime Minister.
Thank you very much, Dr. McElnay. The 8th round of the wage subsidy opened for applications this morning, and the period covered by this round will include some of the time that the country will no longer be in the alert level system. I want to assure those who are eligible for the subsidy that this payment will go out as usual, and you'll be able to use a period of time for your revenue drop that is both in the alert level and the new framework. Also, the 6th Resurgence Support Payment opened for applications this morning. This is the 2nd of the Resurgence Support Payments where we have doubled the rates. Again, even though we will soon move into the framework, this payment will remain open. Since the beginning of the outbreak, we have paid out more than $6.2 billion across both the wage subsidy and Resurgence Support Payment schemes. I also want to give you a brief update on vaccine progress. By midday today, 13 DHBs have vaccinated more than 90% of their eligible population with their first dose. This is the 3 Auckland DHBs, Waikato, Hawke's Bay, Mid-Central, both Wellington DHBs, the Wairarapa, Nelson Marlborough, Canterbury, South Canterbury and Southern. These are all fantastic achievements, and the hard work that's gone into getting there deserves to be celebrated. More DHBs are closing in on the 90% mark, boosting New Zealand's overall first dose rate, which now sits at 92%. Only 7 DHBs are yet to reach the 90% first dose milestone. Taranaki is sitting at 89.1%, just 917 doses short. Bay of Plenty is at 88.9%, 2,293 doses away, and both of these should reach their milestones early next week. Only 19,408 first doses are required for all 20 DHBs to reach the 90% mark. So this weekend is still a great time to get vaccinated, and also to make sure you get a second dose if you've had yours first one more than 3 weeks ago. Finally, before we go to questions, can I remind people that today is the day that bookings open on Book My Vaccine for booster shots of Pfizer. Booster doses are available free for anyone in New Zealand aged 18 years or older who has completed their 2-dose course more than 6 months ago. Our healthcare and border workers are a priority group for booster doses because they are on the front line against COVID, and of course many of them completed their vaccine course 6 months ago or longer. We also encourage our older people, including kaumātua, and those in residential care to take up this opportunity as they become eligible. And it's also worth noting that from today, bookings are available for the AstraZeneca vaccine as well. Happy to take your questions.
So Brian Roche,
We'll go to Amelia first.
thank you. In his latest review of the outbreak, Brian Roche says the outbreak shows the, quote, very poor level of preparedness of hospitals for Delta. Delta emerged in the world last December. What were you doing that entire time to prepare?
Well, the health system's been both dealing with COVID and preparing for outbreaks of COVID continuously since the beginning of 2020. Obviously, while Delta was emerging overseas, it hadn't arrived in New Zealand, but the system was preparing itself. And I know from the conversations that the Minister of Health, the Minister of COVID Response, and indeed the Ministry of Health has had with DHBs, they have been in a period of continuous development, improvement and preparation. Mr. Roche's job is to present us with his free and frank assessment. He's done that, and what I would note is that we have further stepped up that preparedness even since his report was produced. I will just offer Dr. McElnay the chance to respond to that.
I've got nothing to add to that now.
It was preparing itself when he says that there was a very poor level of preparedness. Your statement doesn't match his assessment of it.
Well, what as I say, his job is to give us his free and frank assessment. What I do know is that the health system has been continually developing its capability to deal with COVID-19 and with Delta. He's entitled to his view. What we're focused on is, having received his report, we go back to the DHBs and we make sure that we work with them to address the issues that are raised.
So do you accept that the government's unpreparedness for Delta has cost the economy billions?
No, not at all. I think you're drawing together two completely different points there. What Brian Roche is saying is that he raised issues about the health system's preparedness. That would not have changed the decisions that we made around putting restrictions in place. The health system's preparedness doesn't relate to the fact that we needed to step in to stop the spread of COVID.
He also said that you needed rapid antigen testing as a matter of urgency, that MIQ needed a fit-for-purpose plan. And none of that was in place by the time Delta hit. How can you say that you were prepared?
Well, we can say we were prepared because as a country you can see that we've managed to slow and minimise the spread of Delta. No country in the world has been able to eliminate Delta. We as a country, I think, have done very well comparably in managing and minimising it. Does that mean everything was perfect? Absolutely not, but we learned the lessons that Mr. Roche and others put forward.
You maintain you were prepared for Delta?
I maintain that the health system has done well in managing an outbreak of Delta. I acknowledge things won't be 100% perfect, and Mr. Roche has raised a number of issues which we have been working on. And for example, you heard the announcements yesterday about rapid antigen testing. MIQ, we have continually tweaked all the way through the process, and obviously we've made announcements about that as well.
You told me that in September that you needed to implement them as a matter of urgency, and it still took you 2 months to do all of those points.
Well, you'll be aware that we undertook the trial process with rapid antigen testing, and while rapid antigen testing is and will be an important part of how we manage COVID, you'll also note there have been reports in recent days about the limitations of rapid antigen testing as well. We've moved carefully through that, but we absolutely listened to what Mr. Roche has said, and we've responded to his report in a number of ways. Jason, I'll come down to you.
How concerned is the government of the reports about the new heavily mutated virus variant B11529 that is currently in South Africa that's causing some concern?
The first thing to make clear is that we've checked with ESR and there is no variant of that nature that has come into New Zealand. The advice we've had at the moment is that it is a good example of why we need to be cautious. There's no need at this point to be alarmed about it from a New Zealand perspective, but it does point out the fact that the global pandemic is still going. And New Zealand's response needs to be careful and methodical and cautious while this is happening. I note that the WHO is due to meet, I think, overnight to make its assessment. There is still some debate about the transmissibility of this variant, and I'm sure as we listen to the experts, we'll learn more about it. But it quite clearly is evidence that this pandemic is not over.
Your view as well?
I completely support that. We are closely watching. And just to add that every case that comes in across the border, we do whole genome sequencing on that. We continue to do that. And that's where, if we saw it, we would pick that up at the border.
Sorry, Jason.
Have you got contingency plans or any sort of plans in place for if the virus or somebody who's carrying the virus does come to New Zealand? Do they need a separate MIQ, a separate isolation facility?
Well, we continue to use MIQ to support our processes as we've got them. You'll note that we still have a very high-risk country list at the moment. We're moving to that only having one country on it, but obviously we would monitor closely any further developments from here. The whole point of having that and continuing to have MIQ around is so that we can quarantine people, and we'll do that if we need to do it.
Quick follow on that, sorry. Britain's announced that they will put a travel ban on South Africa and countries with the variant. Will we do the same?
Well, we haven't had any advice to that end, but we will closely monitor the situation.
You're considering it, you would consider a travel ban?
If the advice came to us to do that, as I said, we have a very high-risk country list. At the moment, we're moving to it only having one country on it. We will continually take advice on that.
Yeah, no, that's right. We have a process for reviewing those countries and we'll provide that advice.
Barry.
On the vaccine mandate for the police and the defence force, about 14% of the police are unvaccinated. Are you expecting some sort of pushback there?
Oh, not particularly. As we've seen with the health and education workforces, we've ended up at the 98, 99% level with those, and there do need to be ongoing conversations with those police staff who are affected by this mandate. But I'm confident, as we've seen with those workforces, we'll get to similarly high levels with the police.
Are we sending the assistance to the Solomon Islands?
I don't have any advice about that. I mean, we've obviously had ongoing relationship with the Solomon Islands going all the way back to Ramsey, and at this point I'm not aware that we've been requested to provide any, but obviously if a request were to come, we would consider that.
And on the traffic light system, in terms of breaking it down, how will the country be broken up by boundaries? Will it be by DHB, regional territories?
So we'll have more to say about that on Monday. Obviously, the process that we've gone through up to now is we've used the DHBs as benchmarks. Clearly, those DHBs are very large areas, and so we are going to take some advice on what the best way of doing that going forward from here is. But I think when we make our announcement on Monday, people will be able to see how the DHBs translate to the announcements that we make.
And a question for Dr. McElnay on household transmission. Is there any evidence that our vaccination rates are preventing in-household transmission? Slowing that down?
Yes, there is. We are analysing our own local data to be able to show that. But what we know anecdotally from cases that have been in households that there are household members who are vaccinated who do not subsequently become cases, and other members of that household who weren't vaccinated did become cases. So we are seeing that effect of vaccination even in a household situation, but acknowledging that in a household situation, that's where you're going to get the most transmission. And we do see at a high level, the data, you can see breakthrough infections in households, but equally we are seeing the protection that vaccine gives even in those settings.
Joe.
Dr. McElnay, on the 14th of October, you provided advice to Dr. Bloomfield. It was around the Auckland border, well, it included the Auckland border and alert level 3 settings. You recommended that Cabinet be advised that those using the Auckland border, essential workers, should have to be mandated to be vaccinated. Over the course of the next fortnight, Dr. Bloomfield on many occasions said to me that that wasn't necessary and that testing would suffice and that there was no need to mandate essential workers crossing the Auckland border. Were you surprised, given that goes against your own public health advice to him?
I can't recall the details of that particular piece of advice around mandation of vaccination of essential workers. Is that what your question was?
It was a memo on the 14th of October. You were asked a series of questions which you came back with the answers to. One of the sections was around the Auckland border and those who were crossing it regularly as essential workers. The advice that you provided to Dr. Bloomfield was that there should be mandatory vaccination for those crossing the border as essential workers, and Dr. Bloomfield changed that in the recommendation, saying, rather than saying that it should be, he changed it to will advise Cabinet to. Obviously that didn't happen. Ministers Hipkins, yourself, Grant Robertson, and the Prime Minister have all pushed back on the necessity for that, also the difficulty that there would be in doing it. However, that clearly goes against your public health advice.
Yes, yeah. Well, me and my team, we provide the best advice that we can give in this situation, and that's part of the advice and the subsequent policy making situation. We don't always, we're looking at it from a very pure public health perspective, and sometimes there are significant other factors that need to be taken into consideration. So that's the process that then the DG receives that advice. Obviously, he then provides his own advice on top of that, and then it goes to ministers for discussion and decision.
Yeah, and just to follow up on that, Joe, that it is a process whereby the Director General not only takes the advice from Dr. McElnay and her team, he's also part of a wider group that includes a range of different government agencies and other advisors, and then he in turn turns that into advice that we get. And so some of those logistical issues that you're talking about have to be weighed up against the balance of the value of what was proposed. And so I'm actually not privy to the exact thinking that Dr. Bloomfield had here, but that is the process that we have.
Can I just ask you though, Dr. McElnay, do you believe that the border was left somewhat exposed because the decision was made not to mandate vaccination for those workers going backwards and forwards across it?
I think there's been a very tight management of the border, as we've seen with the number of cases that have been in Auckland and the very small number of cases that have actually been seeded outside of the Auckland border. I mean, our advice is always by nature going to be highly precautionary, of course, but I think what we've seen in the management of the border has actually delivered a very secure and precautious approach to the situation.
Thank you. And just lastly on that, Minister, do you not think that given the responses that I had over quite a number of days from a number of you, it was somewhat dishonest not to mention that the original public health advice around that was that mandated vaccination should have happened?
Oh, well, no, I don't agree with that. I'd have to go back and look at the transcripts of our exchanges to see if I felt there was any concern about that, but we were operating off the decisions we'd made and the advice we got from Dr. Bloomfield. Clearly, if there is evidence that there was a different chain of advice coming through, I'm not even sure that I was especially aware of Dr. McElnay's advice, but I'd have to go back and check for you.
Well, no, we've spoken to it.
So go to the table, just take a couple more and then come back.
Letter today, it said the outbreak had exposed the shortfall in proper engagement of Māori service providers in the outbreak and overall response. Did you accept that criticism, and did that criticism kind of lead to the extra resources being provided?
Certainly I accept the fact that it's been an ongoing piece of work to improve the relationships and the dialogue with Māori and iwi providers. That's just natural as we're ramping up a response and a level of activity that we've never really seen before. So we have been continually developing those relationships. We were also very aware, as we saw the way the vaccination program was rolling out, that we did need to put more resource into supporting the Māori vaccination program, and we did that. I'd also note that half of that funding is also about community engagement and supporting iwi, whānau and hapu to develop their own solutions in the way in which outbreaks are managed. So this is why we have these reports. We do listen to them, we do take them on board, but we were already in a process of developing and enhancing the Māori vaccination program.
Given the way that the outbreak has progressed, I mean, should that have happened much earlier?
Again, it's not that it wasn't happening, it's just that there was an obvious need to keep improving and developing it, particularly as we saw the way the vaccination program was rolling out. So it had always been there. What we've done is put more resource into it. You'll also know from previous questioning that we've had in here that in different DHBs there was a different focus, and Minister Henare and others hit the road, went out and met with people and were able to really, significantly add, I think, to the way that Māori vaccination program works. So continuous improvement, and it's the reason why we have the reports that we do.
Minister, with the police, with the police mandate, why has it taken this long compared to some other government departments such as corrections and Oranga Tamariki? And will unvaccinated police officers be allowed to arrest or apprehend members of the public?
So in the latter part of the question, the process is similar to the one that we've done with the other workforces, that there is a process of working through, now that we've issued the mandate, working through with the workforce to give time to make that transition. But clearly the whole point of this is that we want them to be vaccinated, and when we reach the end point of those discussions, if they aren't vaccinated, then they won't be able to undertake the duties of frontline police officers. In answer to the first part of your question, we've been purposefully working through mandates here. We take these decisions very seriously. We do not want to issue mandates where we don't believe that there is a very pressing need to do so. And obviously with both the police and the Defence Force, they find themselves in situations where we believe it's appropriate, but we were simply taking it step by step.
Considering that police are often engaging with some of the most vulnerable communities, including communities that are frequently borne the brunt of this outbreak, is it fair on them that, as we speak, unvaccinated officers can engage with them?
Well, again, this has been a progressive program, and we've got around, I think it's about 88%, I thought, Barry, but 86, 88%. So we've got the vast bulk of those police officers who have been out there on the front line in that situation, but it's one of the very reasons why we've taken the approach to mandating that we have. Did Jenna want her question, Tova, or do you want to?
It's the same question, it's for a colleague, so we've spoken to a daycare, we work for the same company.
Now.
We've spoken to a daycare where at least 5 kids have caught COVID. Parents say they were given inconsistent messages by contact tracers, and that's resulted in kids going back and getting exposed. Is that good enough?
Well, obviously we want consistency of message, absolutely. I'm not privy to the particular case that you're raising. In general, I think the Auckland Regional Public Health Service has done a really good job in getting information out, working closely with centres. So when we do have outbreaks that involve educational settings, there is quite an established process for working with that centre. So I don't know the specifics of this, but I know that that is something that they take seriously.
How many people are allowed at a private party or gathering under red, and under what conditions?
So under red, the gathering limit remains 100 if you're vaccinated, and if you're not, it will be 25.
Are people in level red expected to ask the vaccination status of their friends and family over Christmas so they can have a bigger gathering of up to 100 people?
If people are wanting a gathering of up to 100 people, we would be expecting that to be a gathering that was one with vaccinated people, and obviously there will be means by which they can check and assure themselves of that.
Have you been?
Oh, sorry, Peter and then Barry.
Can I just ask a question on behalf of our friends over at 7 News Australia? They're doing a story. I've interviewed a woman whose 3-year-old daughter and only child is stuck here in New Zealand. She went to stay with her nan when the borders closed in June. The family can't afford the cost of quarantine here and then back over in Queensland as well. Is there any way that you could make a special exemption so that the mother could pick up her daughter without doing that quarantine on this end?
Those decisions about exemptions and exceptions are ones that find their way through to the Director General of Health, so I'm not in a position to say whether or not it would fit within the criteria that's there.
I mean, there certainly is an exemption process, and I would encourage them to apply under that exemption process.
Does that sound like something that we would want to help with?
These are the challenging, I mean, obviously, when you hear circumstances like that, it's very difficult and challenging, but unfortunately with both sides of that arrangement, because Queensland operates a form of isolation when you return, as well as New Zealand does, it does create quite a difficult, specific set of circumstances. We make our decisions about isolation periods based on public health advice, and so we tend not to vary them without there being a very strong case. On the prima facie, on the facts that you've said, that sounds like a really challenging and difficult case. And as Dr. McElnay says, I'd encourage the people to apply. Sorry, Barry, I did say.
Have you been advised by the police in writing that the traffic light system is going to be impossible to police?
I don't know that the language that would have been impossible. I mean, we had discussions when we were talking about how we would manage it with police, and they were very closely involved in those discussions with Wakatahi and the Ministry of Transport. I do know that they are comfortable with the position we now have with the spot check approach.
So the police are comfortable with monitoring the traffic light system?
Absolutely.
On the new variant, can I just clarify, is the government doing anything proactively to prepare New Zealand for this variant's eventual arrival, other than watching what happens overseas and waiting what comes out of this meeting?
Again, Dr. McElnay and her team closely monitor these situations, and if we need to take action on it, we will. Bear in mind that anyone who's coming into New Zealand goes through our screening processes. We know who they are, we know their pre-departure status, we know their vaccination status. So we have had to, throughout this pandemic, constantly evolve to the new mutations of the virus. The core elements of our approach are designed to deal with whatever mutations there are. Whatever we learn from the WHO and their analysis, we will take on board.
No, that's right, and that's the really important bit is what is actually different about this variant and how might it express itself, and that's what we'll be looking at really carefully to then see what we need to do to be prepared should it arrive.
Concerns are about the fact that it will lessen that vaccine kind of efficacy, I suppose, or the efficiency of that. Are you concerned at all that we're moving into a phase in our response that is so reliant on the vaccine, which might be rendered not as good?
Well, that's the same situation the whole world is in, and the vaccine has proved to be very effective against the variants up to now.
That's right.
I don't believe we're yet at a point where you could conclusively say anything about this new variant in that respect. There's a lot of speculation. I think both Dr. McElnay and I have been reading overnight with variable views from experts. That's the particular phase of this we're at. That's why we'll listen to the WHO and others.
Have any impact on the opening updates that you've signalled for next year?
No, not at this point, but what it does reinforce is why we've been so cautious. And there has been some feedback that people think we should move more quickly. Throughout the pandemic, we've taken a careful, balanced, methodical approach to dealing with COVID. And so the reason why we've got the Auckland boundary coming down in mid-December, Australia and the rest of the world January, February, is so we can manage the impact of the changes that we make. So I think what you're seeing with a new variant is a real, wake-up call for all of us that this pandemic is still going.
I asked for a colleague on the Te Waimana town going into a voluntary lockdown this week because of one case. Are you concerned, or do you think that more towns will follow suit once Auckland's borders open up?
Well, look, the reason we put the traffic light framework in place is to make sure that there are still public health protections in place for areas where we have concerns. We do that on the basis of public health advice. I do know in that particular case there's been a close working relationship between the DHB and local iwi, and those decisions have been made, I think, by local iwi alongside the DHB. So that's the best way to do this, is to have a good, strong working relationship. But from our perspective, we've designed a framework that includes the scope for localised lockdowns. We'll take those decisions based on public health advice.
That's right, and that last bit about the intent of the framework is to be able to be more focused and localised in the response as needed.
Support those towns that are making their own lockdown rules though, or would you expect that they engage first?
As I said, I am aware that in that instance there has been close engagement between the DHB and the local iwi. That is very, very important. We do have a framework that means that we have the ability, based on public health advice, to put in place local lockdowns. It is important that we have that system in place, but equally throughout this pandemic we've tried to work with local communities to do things that work best for them.
Simon Bridges has thrown his hat in the ring for the national leadership. What do you make of that?
What I make of it is that I'm standing on the stage here at a government pandemic briefing, and I'm very focused on managing that. Joe?
That system. Have you got any announcements coming, or can you provide any information around wage subsidy, financial support for businesses on that?
So as I said on the 22nd of October, when we move into the framework, that will be the point at which we finish with the existing payments that we've got. I'll have a bit more to say early next week around how we're managing that transition. We have been clear that under the green and orange levels of the framework, we don't believe that there needs to be across the board support. At the red level, what we're looking at there are particular sectors which may be affected, and we'll look into that and monitor that, but I'll have more to say about that on Monday. I did see you.
Yeah, so just on the proactive release, so just days before cases were discovered in Palmerston North and the Waikato, Cabinet was getting advice that the outbreak was contained in Auckland. Can you sort of explain how the ministry got it so wrong? And looking back, do you think anything more could have been done to stop the virus leaking out of Auckland?
I'm not sure. I'd say that the ministry got it so wrong. I don't think you can put those two things together. I think if I recall, the Palmerston North case was one of the very few number of cases of a worker who tested. If you'll recall, there were very few, if any, cases that actually came off the back of that. In the case of the Waikato, there was obviously somebody who moved backwards and forwards across the border, but not to do with that testing regime and so on. The reality is, as I said in answer to earlier questions, I think with the nature of a Delta outbreak, overall, we have managed that well, and the ministry has provided us with good and strong advice. Does that mean that it's 100% perfect? No, it doesn't. And that's why we try to learn from reports like the Roche report and from the experience we have. But I just wouldn't characterise it the way that you have.
Minister, will you...
Just take one more.
Yeah, sure. Just as Sports Minister, what's your response to this morning's news about the integrity breach by Cycling New Zealand?
Yeah, look, that's very disappointing, and I know that for the New Zealand Olympic Committee and for High Performance Sport New Zealand, they are disappointed as well. I think it's important to note that it didn't affect any of our medals or anything like that at the Games, but still, the rules are the rules, and we expect our bodies like Cycling New Zealand to follow them, and I know that they're aware of that, and it's a breach that is very, very unfortunate. John.
What will your next business support plan have for the international education sector, and also how set in stone is that April 30th date, because that's 2 months after the academic year starts?
So I know that Minister Hipkins has been in continuous conversation with the education sector around this. Obviously, the 30th of April date gives much more freedom for the class of visa holders to come into New Zealand. Bear in mind that because New Zealanders won't be using MIQ in the period from, or to a lesser extent, from the period from January and then to most New Zealanders from February, that opens up more possibilities for sectors like international education, but also other business groups, other group allocations that we might look at. So over the next few weeks, we'll be having another look at how we make use of MIQ. It won't necessarily mean that all of the MIQ facilities that we've had are still being used in the way they've been used, but it does open up some possibilities. And just finally, I also know that Mr. Hipkins has been talking in terms of the move to more self-isolation, how tertiary institutions might be involved in that. So he may well have more to say about that soon.
The key factor?
It'd be one of the factors. The other would be the conversations Minister Hipkins is having with the sector around their ability to manage a more self-isolation model.
Wouldn't you also then need to change border exemptions to let the students in, given that it's only Kiwis who are allowed back at the moment?
So we've already done group allocations for international students. I think we had about 1,000 of those, and
And that
potentially,
in January,
potentially, yes. All right, everybody, have a good weekend.
Thank you.